Chapter 12, Segment 4, Vestibulospinal Responses. Jean-Pierre Florence, a French physiologist, reported abnormal head movements in pigeons after he had cut individual semicircular canals. He demonstrated that the vestibular influences posture control. Vestibular reflexes keep us from falling over. Without vestibulospinal reflexes, our balance would be severely degraded. We would be unable to stand in the dark. We can be thought of as being composed of a series of inverted pendulums, which is the mass above the pivot point. The vestibular system measures the movement of the head and sends commands to the postural control system that help reduce the amount of body sway. Patients with severe vestibular loss demonstrate body sway that exceeds the amplitude of disturbance. Spatial disorientation is any impairment of spatial orientation, more specifically, any impairment of our senses of linear motion, angular, or tilt. And the vestibular nuclei, the primary afferent neuron synapse, descending interneurons that carry information through lateral and medial vestibulospinal tracts. How far these neurons carrying information down the spinal cord depends on their contribution to the balance system. If the interneuron synapses onto a neuron that controls the leg muscles, the information is transmitted beyond the bottom of the spinal. Spatial orientation cortex. Some areas of the cortex certainly do respond to vestibular input, but these areas tend to include a variety of sensory and motor signals. When rotated at a constant velocity in the dark, after about 30 seconds, humans perceive that they are no longer rotating. When rotating with a nearly constant velocity in the light, it seems reasonable that the brain would utilize the visual information indicating motion to better estimate self-motion. Vestibular thalamocortical pathways. Vestibular information reaches the cortex via what are called the thalamocortical pathways. Neurons from the vestibular nuclei carry vestibular information to the thalamus, where the information is processed and relayed to the cortex. Evidence suggests that the temporal parietal insular cortex is involved in the spatial orientation perception. This area receives input from both the semicircular canals and the otolith organs. There is a vestibular pathway that leads to the hippocampus through the cortex and neurons in the hippocampal formation response to stimuli. Includes neurons called head direction cells. Cortical influence. These are the areas of the back of the cortex that receive projections from the vestibular system, also project to the vestibular nuclei. When the vestibular system goes bad, many develop spatial orientation, many experience imbalance, many cannot see clearly unless they hold their heads. Develop cognitive problems and motion sickness that may lead to nausea or vomiting. It is possible to misinterpret the action of people suffering from vestibular disorders. One is mal-de-débarquement syndrome. Most travelers feel a little unbalanced after disembarking from a large ship following extended cruise. Adaptation is known as getting your sea legs. The imbalance is accompanied by motion sickness, swaying, rocking, or tilting while you readapt to firm ground. This is also known as disembarking sickness. Symptoms may last for months or even more. Then there's the Meniere's syndrome, which is sudden dizziness, imbalance, and spatial disorientation. It's so severe that you have to lay down quickly. It afflicts 1 in 500 people. It can start at any age, but typically is in mid-adulthood. Symptoms may include illusory ringing sound, hearing loss, and a feeling of pain or fullness in the ear. Treatments of the disease include medication to lower the pressure in the inner ear, implanted devices that provide tympanic micropressure pulses, and sometimes procedures that destroy the vestibular apparatus.